In this video, we'd like to talk about concurrent disorders. Well, what is a concurrent disorder? They're sometimes known by other names, co-occurring disorders you'll hear, as well as comorbid disorders. Once in a while, you'll still hear people using the old expression dual diagnosis, but that term has really sort of settled in to mean an individual with an intellectual disability and a mental health diagnosis at the same time. So it's not particularly accurate to use that term to describe concurrent disorders. Concurrent disorder simply means that the consumer has both a mental illness and a substance abuse diagnosis. And when we talk about the mental illness, it technically could be any mental illness, but we are normally talking about some of the more common ones. So those related to anxiety and stress, such as generalized anxiety disorder or post-traumatic stress disorder. We could also be talking about mood disorders, such as major depression or bipolar disorder, or psychotic disorders, such as schizophrenia. Now, there are two ways that we can look at concurrent disorders. The first way is that the mental health diagnosis was primary. In other words, it was the first on scene. And it may have caused the individual to use substances as a way of self-medicating or addressing the symptoms of a mental illness. Most of the time, that mental illness isn't even recognized as a mental illness by the drug user. They aren't aware that they have a mental health need. They simply found a substance in their social circle and used it because they found through experimentation that it helped them to feel better. But as a result of the chronic use of that substance, those people may have developed an addiction as well as the underlying mental health problem. The opposite, however, is also true, where a person's primary issue is that they have begun using substances, perhaps as a youth, and through the chronic use of that substance developed an addiction or dependency. That chronic ongoing use of a substance can have a late onset, or what we call tardive effect on the person, and as a result they can actually develop a mental health disorder such as schizophrenia or depression. And in some cases that particular disorder doesn't start to show its signs until years after the habitual use of the substance has gone on. And even more troublingly, there are some people who will start to get treatment for the drug issue, and as they start to take away the drugs, the mental health symptoms may start to become more and more apparent. And it can be very difficult for the clinician to determine what came first, the chicken or the egg. What should I treat and how should I treat it? So it's a very difficult thing to assess and accurately treat a person who has a concurrent disorder. And given the fact that it's approximately 20% of the population, that's roughly estimated, 20% of the population of addicts and alcoholics that have a concurrency, you can see that that's a very challenging issue. Concurrency is common, and some would estimate that's even more than 1 out of 5 people who are addicted. And it can be very challenging to diagnose and treat. What it requires is that the community psychosocial professionals work alongside of mental health doctors, whether it's psychiatrists or GPs who are particularly well versed in supporting people who are going through addiction. And we've spoken about this in an earlier module. There are going to be very different skill sets with different GPs and different psychiatrists. Just because they say that they have an MD or because they have their psychiatry specialization doesn't mean that they're particularly experienced in this area. So it's a good idea to ask around. It's a good idea to talk to other people, including people in psychosocial treatment facilities, and find out where their clients have had the most success. It may involve getting in a car or on a bus and traveling out of town. And while that can be a cumbersome issue, while that can make it difficult in terms of access, it ultimately ends up being a very constructive thing for that particular mental health consumer because they're likely to get the help that they need. And these two approaches, as we said, this psychosocial community-based approach, for example, utilizing a counselor or a 12-step program or both, must be balanced with the medical treatment. And really, it's so vital for the person to be seeing both individuals at the same time, and for those professionals to be talking to each other so that they're not working at cross purposes. And of all of the times when it's important for this comprehensive and integrated approach to occur, I can really think of no time when that becomes more important than when an individual has more than one diagnosis. Now, in this slide, we've talked about the diagnosis of mental health issue and drug addiction, but we could have also talked about people who had what we call dual diagnosis earlier. which is an intellectual disability and mental health issue. And we could have also talked about people who have a physical diagnosis and a mental health issue, such as diabetes or kidney disease, at the same time as they have a mental health issue, because there are real differences in the way the body will process medications and in terms of the medications that an individual can take when they have those physical disorders. And so there's never a more important time for professionals to coordinate than when somebody has more than one significant diagnosis. So concurrency is one of the challenges that can make dealing with or supporting people with addiction issues really, really a struggle. But we're going to move to our journal and ask you to think about what are some of the challenges other than concurrency that might make treatment of drug and alcohol addiction particularly difficult. What things make it different than, for example, supporting individuals with other mental health needs? After you've taken a moment to write in your journal and to look at what others have written there, take a look at the next video.